Hello students, as per previous video, we have learned so many things about general anesthetics. Now, I am going to discuss about some enlisted drug classes according to inhalation anesthetics and intravenous anesthetics. Inhalation anesthetics, nitrous oxide. It is the oldest anesthetics agent which is regularly used in operation theaters. It is a colorless and relatively odorless gas which has also been called the laughing gas. Because of its ability to cause laughing during induction of anesthesia, it is available as a liquid under pressure. It is incapable of producing surgical anesthesia and therefore it is used as supplement to other agent for induction and maintenance of anesthesia. The usual concentration is 70 to 75% with 20% oxygen during induction of anesthesia and 30% of oxygen during maintenance. Rapid onset, profound analgesia, lack of irritation to mucous membrane, and lack of inflammability are the advantages of nitrous oxide. Because of its weak anesthetic potency, it is only used as supplementing agent to other agents. There are clinical uses like dental surgery, obstetrics, post-operative physiotherapy, refractory pain in terminal illness, and maintenance of anesthesia. The least hepatotoxic, teratogenic bone marrow depression. Now, desflurane. Desflurane and sevoflurane are newest anesthetic agent. They have rapid and smooth onset of action and recovery. However, desflurane has pungent smell and may cause cough and laryngospasm and sympathetic activation. It decreases vascular resistance and perfuse all major tissues very well. It has irritating cause apnea, coughing, and excessive mucus secretion. Sevoflurane is chemically unstable and its metabolites are potentially nephrotoxic. And it has low pungency, not irritating property at the airway during induction, making it suitable for induction in children also. It has rapid onset and recovery action. The next is methoxyflurane. It is most potent of all inhalation anesthetics. It is a clear colorless liquid with a sweet odor. It is metabolized to fluoride and to other substances which are toxic to the kidneys. So it is use limited. The next drug is ether or diethyl ether. It is a clear volatile liquid with characteristic odor. It boils at 36.5 degrees Celsius. The minimum alveolar concentration of the ether for anesthesia is 1.9%. Some of the advantages are it is safe, produce good anesthesia and muscle relaxation. It does not affect blood pressure, pulse and cardiac rhythm during light to moderate anesthesia. It is easy to store in a stable condition. And some disadvantages are it is explosive, slow induction and unpleasant, and struggling, breath holding, salivation and secretion. It has slow recovery function and post anesthetic nausea and vomiting action also. It has a property to cardiac arrest like convulsion in children and also cross tolerances. Next is halothane. It is a prototype volatile flammable, and relatively non-toxic fluorinated hydrocarbon. It has a sweet odor. There is so many advantages are there. It has a potent anesthetic, rapid induction and recovery characteristics. It is neither flammable or explosive. It has a sweet smell and it is not irritant in characteristics. Does not augment bronchial and salivary secretion. It reduces post-operative nausea and vomiting. It relaxes both skeletal and ureter muscles. There are some disadvantages that it is sensitive the heart to sympathetic amines. It is used for maintenance of anesthesia. It has a weak analgesic property. It is strong respiratory and cardiovascular depression agent. It is hepatotoxic and malignant hyperthermia. The next is influent. It is a clear, colorless, non-inflammable liquid with sweet water. The induction and emergences from anesthesia is smooth and moderately rapid. It does cause a mild stimulation of saliva, but it is not troublesome. It has so many advantages are there. It is less potent than halogen, but produce rapid induction and recovery. It has some analgesic activity. These are the disadvantages are it is CNS excitation at twice the minimum alveolar concentration and it can induce seizure also.